Treatment of bladder cancer has lagged behind the advances achieved in other cancers, but that has begun to change.
The whole way we treat this disease has been stuck on neutral for about 20 to 25 years.
Prostate cancer has always been the leader in what patients know, what's funded, and what clinicians recognize and think of. And bladder cancer has really been the underdog all this time.
There's been this sort of desert of drug development, a desert of research and funding for research. And honestly, that's all changing. It's an incredible sort of game-changing environment that for people like me and Dr. Taylor and other people who really focus on this disease, it's cool, it's exciting to be in this field. Bladder cancer for decades has been kind of an orphan disease, even though it's the fourth most common cancer in men in the country and overall fifth most common cancer.
Okay.
Bladder cancer is a disease that affects men about 3 to 4 times as commonly as women. There are probably inherent differences in gender that we don't know.
At least 50% of patients who are diagnosed with bladder cancer have a history of smoking.
About 20% have some sort of occupational risk factor or environmental risk factor. Some of the more common ones that we know about are there are certain chemicals that were in the workplace dating back 50, 60 years. They come under the category of aniline dyes. These were in dye manufacturing and identified as early as the 1940s, 1950s, largely taken out of the workplace in the 1970s, but chronic, long-term, well, even short-term exposure could be associated with increased risk.
Pesticides, exposures to particular chemicals, especially benzenes or aromatic amines, which can be in certain factory jobs, can predispose a person. We're even looking in the veteran population of Agent Orange, which was in the pesticides in Vietnam. Agent Orange has a connection to prostate cancer that has been established, and it now has a designation of uncertain link for bladder cancer.
We do have young males that come in and young females, most of which have never had any cigarette exposure at all. So it's concerning as to where in the environment or where did they get this? And in some cases, we're never going to know where the exposure came from.
In a person who smokes, all of those chemicals are inhaled, and all the carcinogens, the toxins, are taken through the lungs, circulated in the bloodstream, and then excreted by the kidneys into the urine. So the chemicals go into the urine and they sit in contact with the bladder lining for hours at a time. But once the lining of the bladder has had this contact and this exposure, the bladder remains at risk for the rest of that patient's lifetime.
Researchers are gaining a greater understanding not only of the risk factors for bladder cancer, but also the underlying mechanisms of the disease.
The whole sort of understanding that we now have about the genomics of bladder cancer. And many people feel like we have such a much better, more in-depth understanding of the biology that's driving a lot of this as well. And that's led to new insights as to how to treat and getting us a little closer to the right treatment for the right patients. Until 2016, there had not been a new drug approved for the treatment of any stage of bladder cancer by the U.S. Food and Drug Administration since 1998. Now we have 5 new approved drugs within that period of time as immunotherapy has really sort of taken hold of this disease to patients' benefit. A lot of interest from the National Cancer Institute, from the U.S. Food and Drug Administration, really an explosion in drug development, but also physicians, physician scientists, researchers are looking at this disease as an opportunity for discovery and for applications of research that has been done in some of these other organ sites. And so I think that there's a lot of things going on.
Join us for the next episode in which Baylor urologists discuss the critical issues of diagnosis and staging of bladder cancer.